Hello, my name is Lorin Haynes. I'm a nurse practitioner student at UNC Wilmington, and I'm going to be talking you through the examination of the male and female genitalia today. For the male genital examination, this can be done standing or lying down. You want to start by examining for pubic hair distribution, which will typically be abundant in the pelvic area, mostly absent on the penis, and scant on the scrotum. You want to check for presence of the dorsal vein. Check the penis to see if the male is circumcised or not circumcised. If they're not circumcised, you want to retract the foreskin or have the male retract the foreskin to examine the glands. And you want to look for any urethral discharge, which could be indicative of an inflammatory disease. After you have finished examining the penis, you want to examine the testes. The testes should be non-tender, but it may be sensitive. You can palpate it using your thumb and first two fingers. It should be rubbery and smooth, and there should be no lesions or anything of that nature on the testes. The epididymis is located at the posterior lateral aspect of the testis, and it should be smooth and discreet and non-tender. The scrotum will likely be a deeper pigmented shade than the rest of the skin. The left side generally hangs lower than the right side, and there may be some lumps that are caused by sebaceous cysts, and that's considered a typical finding for the scrotum. After the scrotum, you want to look for any hernias. Indirect inguinal hernias will generally present as a swelling at the area of the internal ring. Direct inguinal hernias will present as a bulge in the Hasselbeck triangle, and femoral hernias will present as the inguinal canal will be empty on examination. And if any of the hernias are strangulated, they will be non-reducible, and this is considered a something that requires prompt surgical intervention. For the female genitalia, you want to do this in the lithotomy position and drape the female to offer as much privacy as possible. You want to start by examining the mons pubis and the labia majora for hair distribution and any lesions, and the labia minora for any lesions or anything of that nature. Examine the vaginal opening for discharge, and if there is any present, you want to note the color, odor, consistency, and amount of discharge. The next thing you want to do is to examine the vaginal walls. You can insert one or two fingers into the vagina and check for any nodules or lesions or tenderness in this area, and you can ask the patient to squeeze around your fingers or bear down to check for vaginal tone. You can examine the cervix by inserting a speculum into the vagina and examine the cervix for size, shape, position, color, consistency, and the size and shape of the cervical os. And the cervix position is usually decided by the position of the uterus. And you want to check for cervical motion tenderness, which would be a severe pain that's elicited by manipulation of the cervix. To palpate the uterus, you want to place the palmar surface of one hand on the midline abdomen and two fingers with the palm facing upward into the vagina into the anterior fornix. And while pressing down and forward with the abdominal hand, you want to press upward and inward with the intravaginal fingers while pressing back against the cervix with the back of those fingers to try and palpate the uterus. And you want to check for contour, consistency, mobility, any tenderness or masses or anything of that nature. And the next thing you're going to want to check is the next thing you want to check is the adnexa, and you want to do this by placing the fingers of one hand in the right lower quadrant, and the two intravaginal fingers you want to place in the right lateral portion of the fornix. And when you press upward and inward with those fingers, you want to at the same time press downward with the fingers that are placed on the abdomen and palpate by trying to bring the hands together. And typically the adnexa is not palpable, and that's considered a normal finding. So moving on from there, you want to you want to do the rectovaginal examination. You can do this by inserting the index finger into the vagina and the middle finger into the anus by asking the patient to bear down to get that inserted. And you want to palpate the anorectal junction. You then want to insert both fingers as far as they will go. You can ask the patient to bear down to give you a little more depth there. And you want to rotate the rectal finger to make sure that you're palpating all angles of the rectum for any masses or nodules. And you want to palpate the rectovaginal junction and make sure there is no lesions or anything there, and check for tone and thickness and for any nodules or anything of that nature. And moving on to the anal examination, the first thing that you want to do is position your patient, and this can be done in multiple different positions. You could do the knee to chest position, the lithotomy position, the left lateral lying position with the knees and hips flexed, or standing with the hips flexed and the patient leaning forward with their upper body resting on the exam table. You want to examine the sacrococcygeal region and the perianal region, looking for any rashes, any nodules, any lesions, any scars, and you want to look for pilonidal sinuses or pilonidal dimples and any tufts of hair that may be present in that area. After you do that, you want to move on and look at the actual anus, and this can be done by separating the buttocks and using a light source to examine the anus for any skin tags, warts, lesions, hemorrhoids, fissures or fistulas, anything of that nature. After that, you want to actually insert your index finger into the anus. You want to have a gloved lube finger, and obviously inform the patient before you do so, and you ask them to bear down when you insert the finger to aid in insertion. And you want to check for any tenderness, any lesions or masses. You want to make sure you check the posterior, anterior, and lateral portions of the rectal wall while you do this. And in males, while you're doing this portion, you can check for the prostate, which will be located on the anterior wall of the rectum, and it should be felt as something similar to a pencil eraser. It should be firm and slightly mobile and smooth, that it should not be tender. And you want to note the size, the consistency, and whether or not it's mobile. And that will pretty much take care of the anal examination. And as far as the breast examination for females, you want to make sure that you're educating them on self-breast examination. They can do this by examining themselves in the shower, and typically what they will do is examine the breast with the pads of their fingers while in the shower in a circular motion, checking for any masses or thickening or lesions. You want to make sure you're going outward, inward toward the nipple, and covering the entire area of the breast on both sides. They can visually examine the breast in the mirror by having their arms down by their side and looking for any changes in the breast shape, color, contour, any changes with the nipple. And you also want to look for any changes in other positionings as well, like the arms above the head or hands on the hips and flex forward, chest muscles flex forward. And then the patient can actually lay back in a supine position, and by raising one arm above the head at a time and elevating that shoulder on a folded towel or pillow to separate the breast tissue or distribute it a little more evenly over the chest, they can palpate the breast in a circular motion, making sure to cover the entire area of the breast, looking for lesions and masses, and also have them squeeze the nipple to check for any discharge, and this should be done at least monthly. For the in-office examination, you want to first inspect the breasts of the patient, and they need to expose both breasts so that you can compare the two. You want to look for size, shape, symmetry, color and texture, and any dimpling or retractions, any venous patterns. Abnormal findings would be any retractions or dimpling, or any orange discoloration of the skin or unilateral venous patterns that you would want to definitely look into a little bit more. And you also want to look at the nipple and the areola and examine for color changes. If there's any flattening or pulling back of the nipple or areola, that is concern that something may be going on that you may want to look into a little more, or discoloration, like an orange discoloration of the nipple. You also want to examine the breast in multiple other positions, including hands above the head and at the hips, and with the shoulders rolled forward and then bent forward at the waist. After you have visually examined the breast, you want to palpate the breast. You want to make sure that you're having the patient sit up for this part, and you want to do a chest wall sweep, and you want to start at the area of the clavicle and sweep with your palmar surface going downward toward the nipple, and you want to make sure you do this over the entire breast, feeling for masses or lumps. You want to do a bimanual digital palpation where you use one hand and kind of make a flat surface for the breast and use the other hand and palpate, checking for lesions or nodules and anything of that nature. And you want to make sure you're covering the entire breast and going in a circular motion. And you want to make sure that you palpate any lymph nodes. You want to do the infra and supraclavicular lymph nodes and the axillary lymph nodes to check for any enlargement in those areas. After you finish this, you can have the patient lie supine and place one arm at a time over the back of their heads, and place a small pillow or folded towel under that shoulder to help the tissue spread more evenly across the chest. And again, palpate the area of the entire breast, outward going inward, or any other pattern that you want to use. There are several, including the vertical stripe method, the circular method, or the wedge method, as long as you're making sure that you actually glide your hand over the entire breast instead of picking the hand up between touches. And any masses that you feel would be considered abnormal and you would want to look into a little more and make sure you're documenting a description of the mass, like size, consistency, whether or not it's mobile, whether or not it's causing any retractions or dimpling of the breast. And that will conclude that portion of the examination. And now I will demonstrate for you a head-to-toe assessment on a patient. So I'm going to have my patient come into the room. Hello, Mr. Haynes. My name is Lorin Haynes. I'm a family nurse practitioner student at UNC Wilmington, and I'm going to be performing your head-to-toe physical assessment today, just checking for anything abnormal going on. Do you have any questions?
Not at this time.
Okay. Do you have any specific concerns today or anything that's been bothering you?
Just an annual exam.
Okay. If you'll give me 1 second, I'm going to step to the sink and wash my hands. Okay, and we will go ahead and get started. I'm just going to kind of take a look and check your skin. And you see you have some moles. You see a dermatologist on a regular basis, have those checked?
I do.
Okay, sounds good. I'm going to start by just looking in your scalp. Okay, and can I see your hands? Okay. Looks good. Okay. I'm going to check your ears. Do you have any tenderness or pain?
No.
Okay. I'm going to actually look inside your ears. Okay. Okay, I'm going to do a few tests just to check your hearing, okay? The first thing I'm going to do is have you occlude your right ear with your hand. I'm going to whisper 3 words and I want you to repeat them back to me, okay? Cat, dog, monkey.
Cat, dog, monkey.
Okay, and we're going to do the same thing on the other side.
Bear, bench, tree.
Okay, very good. All right, this is a tuning fork. I'm going to, you're going to hear a buzzing sound when I hit the fork. I'm going to actually place it against your head, and when you can no longer hear the sound, I want you to tell me. I'm then going to move it in front of your ear, and you'll be able to hear it again, and then I want you to tell me when you can no longer hear it. Okay?
Let's go. Let's go.
Okay, and we're going to do the same thing on the other side.
Let's go. Alright.
Okay. And this time I'm going to hit the fork again. I'm going to place it at the center of your head, and I want you to hear me. If you can, tell me if you can hear the sound better in one ear or the other. Okay?
It's about the same on both sides.
About the same on both sides. Okay. Sounds good. Okay, we're going to move on, and just going to pop at your skull. Any tenderness or pain?
Nope.
That. Okay. Anything in the face?
Nope.
Okay. Can you open your mouth for me and move your jaw side to side and close it? Okay. And no pain or anything there?
No.
Okay, I'm going to take a look at your mouth. Okay. Can you put your tongue inside for me, please? Thank you. Okay, and stick your tongue out for me. And can you swallow? Okay, and say ah. Okay. And I'm going to check your gag reflex, okay? Okay, now do the other side. Okay, thank you. Sorry, I know that part's uncomfortable. Okay, and I'm going to ask you to do a few simple movements for me if you don't mind. Can you raise your eyebrows and squeeze your eyes shut? Okay, and smile, frown, puff out your cheeks. Can you stick out your tongue and move it up and down, side to side? Can you give your shoulders a big shrug for me? Okay, and everything's okay here? Good. Okay, and next we're going to move on to your eyes. I'm actually going to have you take this little card and hold it about 14 inches from your face, if you don't mind, and cover your right eye. And I want you to read the smallest line that you can see.
937826.
Okay? And if you don't mind, I want you to switch eyes and read it from right to left this time.
628739.
Okay, very good. Okay, I'm just going to take a look at your eyes. Can you close for me? Any pain or anything with your eyes? Okay, open. Look up. Okay. Okay, and just look right at the bridge of my nose. Okay. And look directly at the bridge of my nose, please. Shake your pupils. Okay, and can you look at the bridge of my nose? And then look at the window behind me. Okay, very good. Alright, I've got a few other tests that I want to do to check your eyes, if you don't mind. So the first thing I want you to do is cover your right eye with your hand. Okay, and I want you to tell me when you can see my fingers.
Now. Now. Now.
Okay, and same thing on the other side.
Now. Now. Now.
Okay, and look at my finger and just follow my finger. Okay, good job on the eye exam. Next thing I want to do is take a look at your nose. Any tenderness, pain?
No.
Okay, and breathe for me. Same thing on this side. Okay. gonna take a look inside your nose. Okay. And can you close your eyes for me, please? I'm gonna hold something in front of your nose and I want you to tell me what you smell, okay?
Peppermint.
Okay. And same thing now.
Oranges.
Okay. All right, next thing I'm gonna do is I'm gonna check the trigeminal nerves of your face. So if you could close your eyes for me. I want you to tell me if you can feel this and if it causes you any type of discomfort, okay?
Yes and no. 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 Yes and no.
Okay, and same thing here, you're gonna feel a little stick sensation, okay? Just a little pin.
Yes and no. 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 Yes and no.
All right. Okay, now we're just gonna check and feel for some lymph nodes for any enlargement or tenderness. Does that feel okay?
Mm-hmm.
Same thing?
Mm-hmm.
Okay. Any discomfort?
No.
All right. Sounds good. If you don't mind now, I'm going to have you swing your legs this way so that I can get to your back. I'm just going to take a look at your neck. Okay. Any discomfort?
No.
Okay. Does that feel okay?
Mm-hmm.
Okay. And do you mind looking to your right and to your left, up toward the ceiling, toward the floor, and bend your head over toward your right shoulder and to your left? Any discomfort or concerns there?
No.
Okay. And can you push your head back toward my hand? And forward, and side, and this side. Okay. And down. Okay. That's good. We're going to move on then and check out your lungs. I'm going to first just take a look at your chest. Each time you feel my stethoscope, I want you to take a deep breath for me, okay? And same thing on your back. All right. This time, each time you feel my stethoscope, I want you to say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. And same thing this time, but whisper 99. Okay, and this time I want you to say E each time you feel me touch you.
E. 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 E.
Thank you. Okay, and take a big deep breath for me. Okay. And say 99 for me each time you feel my hands touch you, okay?
99. 99. 99. 99.
Okay. Sounds good. Okay, you're just gonna feel me tapping on your back, okay? If you don't mind, I'm going to have you take a big deep breath and exhale completely and then hold your breath. Okay, you can breathe normally. And this time I want you to do the same thing, but when you take your big deep breath, I want you to hold it before you exhale. Okay? Okay, you can breathe normally. Okay? Alright, you can swing your legs. Actually, one last thing before you turn around. You're going to feel me kind of hit you on the side. I want you to tell me if you feel any pain or tenderness, okay?
No. No.
Okay? Go ahead and swing your legs around for me, please. I'm going to listen to your heart now. Okay? If you don't mind, go ahead and lie back for me. And I'm just going to feel your chest, okay? I'm going to listen again. Okay? And if you don't mind, I'm going to have you roll over onto your left side. Okay, you can roll on back over onto your back. And we're going to move on to your stomach assessment, okay? Just going to take a look first. Have you had any pain or tenderness, anything with your stomach?
No.
Okay. We'll listen to your bowel sounds first. Your bowel movement's been consistent.
Mm-hmm.
No changes. I'm actually going to listen to some of your arteries now, okay?
Okay.
Okay, I'm going to press on your stomach. I want you to tell me if you feel any pain or tenderness, okay?
No.
gonna go a little bit deeper, okay? Okay?
Yep.
No tenderness.
Nope.
Okay. Alright, next thing I'm going to do is try to feel for your liver and spleen and kidneys, okay? And you can tell me if there's any discomfort during this process. I'm going to slide one hand under your back. Okay. And can you take a big deep breath in for me? Okay, and you can breathe normally. And same thing on the other side. Okay. Okay, I'll move my hand down a little. Deep breath. And same thing on this side. Okay. I'm going to measure your liver. Okay. Check your lower extremities. I'm going to check for capillary refill in your nails, okay? And same thing with your hands. Okay, I'm going to feel for some of your pulses. First at your wrist. Okay, you need to feel your growing area for your pulse, okay? So you feel my hand. And same thing on this side. Turn me up a little for me. Same thing on this side. And your feet. Okay. And I'm going to examine your neck veins now. You can look to your left there for me. And can you look to the other side? Okay. Thank you. All right, I think actually I need to go ahead and palpate for a few lymph nodes. Okay, it's going to be near your growing area, so just know that you'll feel my hands. Alright, you can go ahead and sit up for me. Okay, next thing I'm going to have you do is your elbow. Any pain or tenderness there? Okay, can you flex your elbow and extend it? Any pain? Okay. Any tenderness, discomfort? Okay, and can you flex and extend? Alright, we're going to do the same thing with your knees. Any pain anywhere?
Mm-hmm.
Okay, go ahead and flex. And extend. Good. Any pain or discomfort
No.
there? Okay, go ahead and stand up for me. I'm going to just check your back now, okay? Tell me if this hurts.
No.
Okay, go ahead and bend forward towards your toes. Does that feel okay?
Yep.
Okay, stand up and lean back as far as you can go. Does that hurt?
Nope.
Okay, go ahead and lean over to your left side and to your right. Any pain or discomfort?
Nope.
Okay, and if you will rotate to your right and to your left. Any pain or discomfort there?
Nope.
Okay, you can go ahead and have a seat for me. All right, Mr. Haynes, I think that will conclude our examination for today. Everything looks good. I don't see anything concerning that we need to look into any further. At this time, everything looked pretty good. Do you have any questions for me?
No, ma'am.
Okay, any concerns about anything? Okay, that sounds good. I thank you for coming in today, and it was a pleasure meeting you.
Thank you.